Hi class, in today's session on biomaterials, we shall learn about wound healing. So far, we have learned about the implants, the material that an implant, the material that is used to make a like the biomaterials that are used to make an implant. How does the implant perform in the human body? What is body's response to the placement of an implant? However, if you are placing an implant inside the body, there has to be a wound that is created. So let us just learn about how the wound heals after the performance of the surgery or after implantation. So wound healing basically occurs in forced phases: hemostasis, defensive or inflammatory phase, proliferative phase, maturation or remodeling phase. So hemostasis, hemo is blood, stasis is season or stopping. So this phase begins at the onset of the injury. So injury here is a wound that we have created to place our biomaterial, to make our implant. So the major objective of this phase is to arrest bleeding. So while being operated, the surgeon takes utmost care that not much blood is lost while operating. Like you can have the patient in hypothermia, or you can use devices such as electrosurgical unit, which would coagulate the blood vessels while cutting, or lasers while cutting, so that would reduce the blood loss. However, body also has a responsibility to arrest bleeding. That's natural to us. And that happens when the clotting factors are activated and the clot plug is formed. Now, clotting process is from your physiology lessons. I hope you remember all. There are quite a few clotting factors, and how ultimately your fibrinogen is converted into fibrin, and that forms a net or a mesh across your wound, and that would just allow serum to pass through it. It doesn't allow, or the platelets, they form a plug, and they do not allow blood, RBC and WBC, to pass through the plug. Only serum can be passed. You can refer to the clotting mechanism in the physiology, like from your physiology book. The second phase is the inflammatory or the defense. Now that the blood is arrested, like the flow of blood, bleeding is arrested, the next stage would be to fight an infection. Now, while making an incision, you are opening the wound. Now, no matter how sterile your instruments are, the body surface itself has quite a lot of microorganism in it. There are very good chance that the surgical site might get infected from the body, from the microorganism present on the surface of the body. I mean, you might argue saying that we are sterilizing the area with spirit, and then we are putting betadine, and then we are making the insertion. But still, surgical site infections are very, very common. Any major surgery you have, there are surgical site infections. The risk of surgical site infections. So now microorganism would have entered the body through the open wound, and that needs to be destroyed. Also, there may be cell debris because you're making an incision, so there are cells that have died. So debris of those cells that need to be removed. So usually neutrophils are responsible for removal of the cell debris or unwanted microorganism. So the population of neutrophils peaks between 24 to 48 hours after the injury or after the surgery, and then it gradually reduces if there's no infection. Now, this phase prepares the wound bed for the cell growth. So, it is just clearing the wound bed of any debris or microorganism, and it is trying to, create a conducive atmosphere for cell growth. Now, the third phase is the proliferation phase. So, this phase focuses to fill and cover the wound, and it lasts anything between 4 and 24 days. So, this phase is again divided into three stages. The first is the filling of the wound, where shiny, deep red granular tissues fill the wound bed with connective tissues and new blood vessels are formed. So once the wound is filled, contraction of the wound margin occurs. So the wound would start healing from the edges and it would try and close towards the center. So during contraction, the wound margins contract and pull towards the center of the wound. So it just starts to close from the edges and joins in the middle. Now the last stage is the wound closure, where epithelial cells arise from the wound bed or the margin and begin to migrate towards the wound bed in a leapfrog fashion till the wound is totally covered with epithelium. So this is when your wound is like you have those brown scab around your wound. Right, you would have had injuries when you are a child. You would have scraped your knee or scraped your arm, and so the brown layer is actually the wound covering or the wound cloth. So the last phase is the maturation or remodeling phase. So during the maturation phase, the new tissue slowly gains strength and flexibility. So what happens is if you have an injury or if there is a if you have undergone a surgery, then although the sutures would have been open and your wound is like completely closed, but still it is not as flexible as it was before the incision. So the maturation actually results in formation of collagen fibers which reorganize the tissue, remodels and matures, and overall strength is gained, and there is an increase in overall strength. Now this strength is limited to 80% of the previous strength. Now a remodeled tissue might not gain as much flexibility as the original tissue. The maturation phase varies greatly from wound to wound, and it lasts from 21 days to 2 years, depending on how deep your incision is and how quick your recovery rate is. I think that's all we have for wound healing. I hope you had a fruitful session, and I'll see you again soon with another lecture. Thank you.